Welcome to the Next Level Podcast. I'm your host, Scott Dickinson. Today, we interview the great Dr. Kickass, otherwise known as Mike Piekarski. Mike holds a black belt in Jiu Jitsu. He's a former professional MMA fighter, but also he's a physical therapist. So today, he brings these two worlds together for us. On one side, breaking bodies, and the other side, mending them back to health. He also connects some dots for me as I continue my journey into martial arts as both a next level businessman and jiu-jitsu practitioner. Please enjoy Dr. Kickass. Mike, welcome to the Next Level Podcast. Thanks for joining us.
Thanks for having me. Looking forward to it.
So you are on Instagram, Dr. Kickass. Please, for the listener who doesn't know you, could you introduce yourself and how you came to get that Instagram handle?
I'm a doctor of physical therapy. I'm a black belt in Brazilian Jiu-Jitsu. I used to fight mixed martial arts. So the name is kind of like a funny story. So when I was in college, when you're playing with your buddies, we used to play Halo, and I'd have my handle was like Captain Kickass. And fast forward, I go to PT school, and then I was like, well, technically I'm not a captain anymore. I've graduated to doctor. And I came up with the idea of doing the Instagram page because, I'd be rolling with some purple belts, and I'd go for footlocks. They used to tap super quick. And I don't play the footlock. I don't understand that. And really what it came down to was that these purple belts, or just a lot of people I found, had a misunderstanding of like twisting leg locks, like heel hooks, and straight ankle locks. And it's vastly different because a straight ankle lock is legal at like white belt kids divisions, and heel hooks are illegal in almost every division. Last year they made it legal at IBJJF for no-gi, brown and black. So anyway, I was kind of annoyed with like the lack of understanding. So I was like, I should, make an Instagram and just kind of talk about this stuff. And then I was like, well, I should come up with a name. And then kind of like the whole Dr. Kickass thing just kind of like became funny. Like I just like did it randomly, and then it kind of like stuck.
Yeah.
There was one point where I'd like considered to change it to something like a little bit more professional. But I look at a lot of the people that kind of are doing that, like jiu-jitsu and physical therapy, and all their names are so generic. And they was like, you know what? Like, I'm just going to run with it. And I think at this point, I haven't lost any credibility with the hilarious names. So it's all good. It's very catchy, which is, there's people who I don't think know my name. They just call me Dr. Kickass. So yeah, so it's all good.
So when did it start? Do you remember what year roughly?
So I started my Instagram, I believe 2016, somewhere like 2016, I think. I graduated PT school in 2015. So it was somewhere around there, which I came up with the idea of doing it.
Gotcha. Okay. So several years in now, but the initial inspiration was to explain the difference in anatomy of what tissues are being stressed during an ankle lock versus a heel hook. That was the initial idea.
Yep.
And then it's grown from there quite significantly, huh?
Oh yeah, quite significantly. It was actually funny because I'd been like, from Instagram, like Instagram is like frustratingly chaotic. Like you post like some great content and nobody sees it, and then you put like a terrible piece up and everybody loves it. It makes no sense. So there was one point like early on where I'd been posting content, and I'd put like I spent a week on like a post, and nobody would like it. And I remember like literally like I was like, I think I'm done. And then randomly this one Instagram page called the Leg Locker shared one of my things, and they had a decent following. And then it started to grow. And then I'm like, okay, I think I got something. And then I stuck with it.
Oh, wow. Beautiful. And then at that point, when you had started it, I guess so you were out of PT school. And so you're already a black belt in jiu-jitsu at this point, correct?
I was a brown belt at jiu-jitsu at this time.
Okay. Okay. And so you take this expertise in two very specific things, physical therapy and jujitsu. And what are you doing with it today? So like, what does your day look like? Are you treating patients in a clinic like a normal PT? Are you working with people online? How does it look?
So I have two different jobs. So I work in Eastern Washington locally. So I work at a outpatient hospital, which is pretty standard physical therapy. And unfortunately, in this area, there's not too many combat athletes other than the people at my gym. So for the most part, I'm just treating regular people, athletes. Before I moved to Washington, I was working in Sacramento, and in Sacramento, it was a sports physical therapy clinic. And then from there, like Sacramento was kind of a cool area because there was a lot of jiu-jitsu gyms, a lot of MMA fighters. But like they didn't have this like Creonche attitude. So for like people who understand jiu-jitsu, like if like you trained at another gym, you're considered like a traitor. I didn't really ever get that feeling because at this time I was a black belt. So people would want to work with me even from different schools. So when I was in Sacramento, I got to work with more combat athletes in person. But in addition to doing my part-time PT work, I also have I have a company. It's online, performance coaching, which black belt sports performance, where I work with combat athletes. So essentially, it can be anything from kind of like joint health work. I do strength and conditioning. Also do like return to sport coaching, and this is kind of where someone goes to physical therapy, they get discharged, but they're not quite ready for returning to jiu-jitsu. And then I can kind of fill in the gap because that's where like insurance, because you know how like you worked as a PT, like insurance doesn't care if like you're ready to go back to jiu-jitsu. They just want you to have less pain. So all right, you got a good understanding, here you go, but like you're not quite ready to go back to jiu-jitsu. So that's kind of the niche that I fell in for my online work.
Gotcha. And then so if someone gets injured and then they find you, is that usually after they've actually finished physical therapy, or do you end up working with people who never even went to PT and you are their PT throughout the spectrum?
I mean, I try to just the best I can. I try to have people go through some physical therapy in some
Yeah,
capacity, just because, like again, just you know how states work. Like I want them to go through physical therapy and just kind of like finish out and then work with me.
sure, sure. So by the time that you start working with them, they're usually not in a position where they would need hands-on care, right? So you are prescribing exercises and treating in that manner, correct?
Correct. Yeah. I mean, yeah. At this point, like I said, at this point, like there's no manual therapy, obviously, because it's all online. They don't, you know. I'm not doing any diagnosis or anything. Like
Okay.
literally at this point, like they're done with the kind of the medical side, and I'm just again, making them ready to go back to sport. Because again, like from a physical therapy standpoint, the way that I think about it, I break it up into like 4 phases. So you have the acute phase. You just get a neck injury, someone cranks your neck. Subacute, where it's not really hurting that bad, but it's still a problem. And then people start doing like traditional strength and conditioning, and then that last phase is the return to sport. So I kind of like step in on that like third and fourth phase. So but usually by then, like they just don't have a lot of pain, but they're still limited.
Gotcha. Okay. And then you mentioned, someone say has neck pain. So if we could double click on neck pain in the world of jiu-jitsu and MMA, first maybe a nice and broad question, take it anywhere you like. Why is neck pain so common in these sports?
Yeah. I mean, like half the attacks in jiu-jitsu are just strangles, chokes, neck cranks. So it's like your neck is going to be abused way more than like a traditional field sport. But not even, like you could take any contact sport. So whether it's wrestling, judo, mixed martial arts, it's just there's going to be a lot more trauma to the head, whether if like you're striking, boxing, kickboxing, like you're getting hit in the head. Wrestling, like literally people in wrestling will use their head as part of the takedown. There's a takedown called the blast double, where you just literally just batter ram your head into someone. Judo, like you're going to be thrown a lot of times, like you might land on your head. Because that's the thing with judo, which is interesting. Like you learn how to fall correctly. The problem is if you fall correctly, it's considered ippon, which means you lose. That's like the checkmate. So
Mm,
like judo athletes actually don't want to fall correctly. Like they want to, because if they land flat in their back, match is over. But if they land on their side, like their opponent might get a point or something. So they actually want to land incorrect. And sometimes that means like landing on their head. So just the amount, other than like rugby and football, I don't think there's any other sport that's gonna have the same amount of like just head trauma. Not like head is in brain trauma, but just impact on the neck than any other field sport. So it's kind of interesting because like, you work as a physical therapist, like most traditional like neck rehab is just basic neck stretches and then like scap strengthening, where like
Yep.
there's like you're just like missing this thing. Like the concept of like strengthening your neck just doesn't exist.
Right.
And it's kind of frustrating, like, because ultimately, like, our goal as physical therapists is to get someone out of pain, restore the range of motion, and then get it strong. But like for the neck, it just doesn't exist. And anyway, it's kind of mind-boggling.
Why do you think that is? Why do you think that neck strengthening is the boogeyman of PT?
Well, I think, back to the phases of PT, I think a lot of times people kind of get stuck. Like, I think most outpatient physical therapists are good in phase 1 and 2, which is you just hurt your neck. All right, let's kind of calm you down. Let's get you back. And I feel that like at that point, whether it's insurance or just a lack of knowledge, like they're done. Like a lot of physical, I know you're an ATC, so I'm sure you've more understanding of like the strength and conditioning, but like a lot of PTs like aren't working with athletes, so they just like they don't know what to do and it's over. um some of it is also, I mean, kind of like why you developed your thing is like I don't think there's a good way to do it, right? Because like I will use like various isometrics because I think it's an easy way to modulate. You don't quite have like objective data on like how much that other, unless you could like hook up like a dynamometer, which I
Yeah.
don't do that.
Yeah.
Like you don't really have like a like, okay, so this neck is able to do like 5 pounds, or so.
Right.
But isometrics are a good place to start. But like other than that, like other thing I've seen is like you jump from that to like neck bridges, and you know and in my opinion, like obviously like I do jiu-jitsu, I've done neck bridges in the past. I just don't think it's kind of like, like I don't think the juice is worth the squeeze. I think it goes from like, you know self isometrics to like full body weight. It's like too much in my opinion.
Right.
um and then in addition to like with neck bridges, essentially you're doing like an axial compression with full body weight. Like if there's anything that's going to put too much stress on like your vertebral discs, it's going to be axial compression with full body weight.
Right.
So, and I don't know if you've ever listened to Joe Rogan, but there was like one podcast where Joe Rogan had Mike Tyson on. Mike Tyson, obviously he's he was a physical specimen in the day. He used to do neck bridges. Well, now he's in his 50s, and he was talking. He's like, yeah, that was a mistake. Like, I don't do those anymore. Like, obviously that's someone like at one point, Mike Tyson was considered like the baddest man on the planet. His traps were gigantic, and he was like, no, I don't want to do neck bridge. Like, I wouldn't recommend doing neck bridges.
Mm.
But that's
Now,
all. Like, yeah,
yeah.
like
For
20
those
years
who,
after. Sorry.
I was just gonna say, for those who don't know, what is a neck bridge?
So a neck bridge would be like you in a various position, but you like put your head on the ground. So you're supporting your full body weight with your either your forehead or the back of your skull. And then you're kind of rocking forward and back and side to side. So again, it's like a closed kinetic chain, a weight bearing exercise where you're kind of moving through. And like I understand where the concept came from. I just think it goes too far too fast. And I think there's better ways to ramp up strengthening than going from like nothing to body weight.
Of course, yeah, and it is kind of ridiculous. That's like going from doing a push up to bench pressing 500 pounds, and
Exactly.
there
Yeah.
there is no middle ground there. Yeah, that's a good point.
Yeah.
So for someone who's getting into jujitsu or getting into wrestling, do you have any recommendations for prevention of injury? Do you think about that for the neck? Do you suggest isometric strengthening? Like, what would you do if you were first starting and didn't want to get neck pain?
So first thing, the way that I treat the neck will be, I like to try to teach someone segmental motion. So again, the cervical spine, there's 7 vertebrae. The first two kind of move slightly different, the upper cervical, but C3 through C7 for the most part, like it's not like one joint, it's multiple. So I try to teach people the ability to create segmental flexion or extension. And this is just the idea of, this is a little bit more common in the lumbar spine, but a lot of times when people throw out their back or they get these like spinal buckles, it's because like one segment is doing more than the other. It'd be like if you are like moving, right? And you have 4 buddies, and then like 3 of them are just like eating pizza and drinking beer, and like one guy does all the work. Well, what's going to happen? That guy's going to get overused. So I like to teach segmental motion. Second thing that I would do is I want to make sure they have optimal neck motion. Because there's like certain movements in jiu-jitsu, like inverting, where you kind of you roll over your shoulder blades, but if you do it correctly, you're not actually straining your neck. But the problem is a lot of people either don't know the move correctly or they don't have enough thoracic or cervical flexion, so they end up rolling over their neck.
Mm,
Um, if you take like a lot of break falls or rolling, like a lot of people hurt their neck that way because they try to roll directly over their head. So I want to make sure that this athlete has full range of motion. I initiate people with isometrics. I think it's an easy place to start. We can either do it in neutral or various end ranges. So end range flexion, and then I'd kind of respond there. Any type of like cervical stretch, I could just add an isometric at the end. And that's pretty much where I'll take people if I don't have any equipment. Because again, restore range of motion, initiate some kind of strengthening, and then we can with isometrics, we can experiment with like the ramping intensity. So it's like a slow ramp where I'm building strength, or it could be a fast ramp, which is like if I'm working with a combat athlete and we want to create like cervical stiffness, like someone who gets hit in the head, I have to make sure that they can brace very fast so that they can absorb the impact of that punch.
of course. Yeah.
Yeah.
Just hearing you talk about the anatomy, I flash back to the intricate vertebral arteries as they work up through the cervical
Yeah.
lateral regions, and
Yeah.
and then it converges, but through that, specifically at C1, C2.
Yeah.
Those arteries can be under significant strain if there's a lot of rotation, for example.
Yeah.
And I was just wondering if in your career, or just being in both this MMA world and the PT world, have you heard of any VBIs, any strokes, anything like that from a neck crank or from some kind of uh, attempt at submission on the neck?
Yeah, there's I'm trying to I'm trying to remember the guy's name. But there's this one jiu-jitsu athlete. He had a stroke, I think like 3 or 4 years ago. And then since then, he's been kind of like the forefront of kind of like collecting all the data.
Mm.
And I think he's working. There's a physician out of, I think, Minnesota, Dr. Spellflung, I believe is his name. So he does a lot of research on like looking at like how is essentially vascular restraints or chokes or strangles, like how they work on the body. So he's done some basic research, but then he's also done some research on like how long does it take for someone to go to sleep from a choke, and he's not actually like choking someone. He's just looking at like he was like looking at UFC footage of like when the choke is applied and when they go to sleep. Um,
Interesting.
but I believe I don't know if it's published yet, but the guy who's running the forefront, and I can't believe I'm forgetting his name. Um, it's going to come to me. But anyway, he sent me some early data so he's trying to collect all the information about people who've had strokes from jiu-jitsu. And the numbers are still pretty small. Um, one of the things that they think might cause a stroke is really going to be like a carotid dissection. So the current hypothesis of how that happens would be if someone gets a strangle, if their head's getting extended and rotated, like you said, like that could create some stress on that carotid artery. Again, I don't know if they've done like a ton of real research. A lot of this at this point is like case study based.
Mm.
I believe most of the strokes they've heard of are going to be more carotid dissections than like vertebral. But it has happened. Um, I don't know what the numbers are, because I mean, like if you look at like the people getting carotid dissections, like you could get that through like tennis, like even non-impact. I don't necessarily know if it's like specifically getting strangled too much or holding out. It just could be like just as someone's applying a choke, like the neck is strained in a certain way. Some people are more predisposed to this. Um,
Yeah.
yeah. So yeah, like I said, like there is some stuff. If you're curious, I can send you some of the papers that I have.
Yeah, but yeah, it's just it's interesting to know that is out there, and some people are thinking about it. So for for those who don't know, and I was included about a year ago before I started jujitsu. What are the reasons that someone would tap when someone's attacking your neck? So there are blood chokes, an air choke, and then a neck crank. Can you talk through each of those and why the person would end up tapping? Because I thought it was really interesting, feeling each one, like the guillotine. Great job at crushing my trachea. I really just can't get any air in.
Yeah,
That's
yeah.
why I have to tap. Can you walk us through those?
Yeah, so even though in jiu-jitsu for the most part things are just described as chokes, but if we're going to be, you know, specific on what actually happens, a strangle would be an occlusion of your vascular system. So we're not quite blocking the blood from getting their head, but when you put pressure on the carotid artery, what happens is if I think there's receptors that when they detect about like a 50% pressure, or actually I think the pressure is like 100 milligrams of mercury. Like I think that's like the number. Like so, if you have bilateral pressure of a sufficient amount, it kind of like triggers these receptors in your brain, and then they say, hey, like I want to preserve you, so it starts to make someone pass out. So essentially,
Interesting.
you're putting someone to sleep. And again, key things is you have to do submission amount of force, which is about, like I said, 100 millimeters of mercury pressure. Usually it's about 8 to 11 seconds, and you have to include both arteries. So if you just put pressure on one, for the most part, someone isn't going to go to sleep. So that would be like a vascular restraint. A chokehold would be a airway occlusion. Again, you're blocking the airway, so someone can't take pressure. That tends to be something like a guillotine. Sometimes like no-gi chokes are a little bit less clean, like a gi choke, just because of the way that you can grab a gi and wrap it around. They tend to be a little bit better being blood chokes. But like head and arm chokes, guillotines, sometimes they just, again, the person can't breathe in. And then the last would be a neck crank, which is the person can breathe, they're uncomfortable, they're not going to sleep, but there's just so much pressure on the neck, it's just really painful. Again, these could be guillotines, could be like a hidden arm choke, like Darce's anacondas, and they're just really painful on the neck.
Yeah, and that pain, it's really something to behold, and until you've felt it, you don't think it would cause you to tap. But certainly, from my perspective, it's just scary. That this person has complete control over your head, and they are feeling like it's going to snap your head off. So anyway, that the neck crank is a real thing, at least for me as a beginner. So you mentioned neck stiffness. And that can be both a good or a bad thing. Being able to bring it on and then release it would be
That's
the
it.
situation where it's a good thing in MMA. So talk us through why neck stiffness is important. I know you've done some posts about this before. Why is neck stiffness important? Generating it fast so that you can absorb a blow. Talk us through all that.
So like if we look at a concussion, right? Like so there's some literature on like how can we mitigate concussion? And there's no one way, but there's three methods that seem, when they work in conjunction, have the best effect. So the first one is, can you actually see the strike? Because if you can't see the strike, like, so it's a common thing in boxing is like the strike that you don't see is the one that's going to put you out. Because again, if I can't see the strike, I can't actually brace for it. So first I have to see it coming. Then I can see it coming. So I see there's a strike. Can I actually volitionally brace again so I'm able to respond to it? And then that third is, do I have enough neck strength, cervical stiffness to actually absorb the blow? Because the idea is, like, when it comes to like a concussion, they used to think it was like a counter coup injury where your head gets thrust one way, so your brain hits your skull and then it moves back. Now they feel like it's more axonal acceleration. So the head gets to move fast. So how do we reduce force? Well, again, we have to brace or be able to absorb it. And it's interesting when you look at literature, because what they found is that rotational impacts tend to have a little bit more result in concussions more. So like a lead hook, some type of like roundhouse kick, anything that forces your head to kind of move that way has a little bit more chance of making a knockout. That's why in boxing, usually they say protect your chin, which is your jaw. It's not just getting like, and you can get a linear strike, like someone just throws a jab, hits you in the jaw. For the most part, that hit in the jaw will force that rotation. So in regards to neck strength, again, assuming you can see it and assuming you can react quick enough to brace, the idea is that I want to stiffen so that blow will reduce that acceleration, theoretically reducing the impact of the blow and reducing the chance of getting concussion.
Boom. That's it, folks. That's all you need. Be able to stiffen up such that the head cannot accelerate. That is the key. I remember growing up and watching the UFC, and this was before anyone had told me like the ideal place to punch to knock someone out, to make the lights shut off. And I kept observing that it was indeed, if someone hit their jaw, and that's pretty counterintuitive as a young dude just trying to figure it out. Why is it that when you get struck across the chin, things go dark? I've heard of some kind of a nerve being pinched. Is this true? Can you speak to any of this? Has it happened to you?
I've never been knocked out. I've been dropped and I've been rocked, but I've never been knocked out. I have had a concussion actually. Well, unofficially, I had a concussion. I got rocked pretty bad in a fight. I ended up winning. I wasn't a physical therapist at the time, but like with what I know now, I'm like, I totally had a concussion. But the ringside physician didn't. I don't actually. So actually, funny enough, because you're in Pennsylvania. Like this fight was in Pennsylvania, and the state athletic commission in Pennsylvania is not the best. So it was a pro fight, and they're supposed to check me after, and they didn't. And I don't know why, because they should have. Definitely had a concussion. Pretty sure I had a broken nose, and I mean, it could have been also like I just won my fight and I was excited and I wanted pizza. I don't know. I don't know what happened. All I know is you're supposed to check your fighters afterwards. So, so why does the jaw knock someone out? I don't actually have any real evidence if it's a nerve. It's one of those things where with scientific research, some of it is like, some of this stuff is like, I imagine might come out more now that mixed martial arts is growing, but there's just not a lot of evidence, so I can't really say for sure.
Yeah, but it is very true though, right? Like, so if you strike someone across the jaw, that is the highest percentage shot that will make them go dark, right?
Yeah, I would say jaw, temple, but the temple makes sense because the temple's where the skull's fairly weak, because that's where all the bones connect. So that one kind of makes sense to me, but the jaw, I'm not 100% sure.
Yeah. Okay, so I'm just curious, as you're experienced in actually fighting people in combat, when you're in the fight, what's the most painful thing that can happen? Is it getting punched in the nose and then that terrible nose hit feeling? Is it, I don't even know if I can speculate. What is the most painful thing in the moment, or is no one even feeling pain when they're in a fight? Is it just all instinct at that point?
Yeah, I mean, honestly, like when you fight with adrenaline, like you don't really feel pain. But like again, I've been dropped, and I was like, it almost feels like you got hit, like you feel like a gong goes off in your head, and you know it's bad, but like it doesn't like hurt. You're like, that was not good. I don't want to let that happen again. It's kind of funny because like in mixed martial arts, in essentially for the most part you're fighting without shin guards, even though you train with shin guards, and Muay Thai fighters will specifically do shin conditioning. A lot of MMA fighters do not. And I was always worried about like, because again, like I'm sparring, I'm always wearing shin guards, and like even then, even when you hit with shin guards, it's still not fun. And I'm going to my fight, I'm like, what's going to happen when I kick? And I was surprised, like I threw kicks that got checked and they didn't hurt. I'm like, oh wow. But I think that's just adrenaline, not because like my shins were conditioned.
And then the condition is like frequent hitting with some hard object to strengthen the bones, right?
Well, so I actually like that's what a lot of people do. I don't think that's the best way, because the idea is if like you hit your bone, there's a chance with like an object, like they'll use like a glass bottle, there's a chance you could create micro trauma to the bone itself. So in Thailand, what they do is they'll kick like a banana tree, which is softer than bone. So when you see people kicking a tree, like they're not kicking a tree in the US, it's just a banana tree in Thailand. So I think just like kicking a heavy bag or kicking pads is going to be a much better way to condition your shin, because the pads are going to be softer than the bone, so there's no chance of damaging the bone, but you can start to kill the nerves, so you actually can use that shin as a weapon.
And of course, this brings my head to the Conor McGregor injury where he had a tib fib fracture in the middle of the fight. Um, so you're watching this fight, and then usually at some point, I don't know, maybe within an hour. I haven't actually looked at your timing, but frequently after some crazy thing happens, you have put together an awesome post where you've got some photos, some videos describing the injury. Then you do a little write up. Talk us through that process. Like, are you alone, like in the cave, like getting ready to post, like when something happens? Like, what does it look like?
Yeah, a lot of times, like around big fights, like especially someone like Conor McGregor, like I'm looking for something that would be interesting for me to discuss. So I'm on the lookout. It's I know my fiance doesn't really like it because like she's like, let's go to sleep. I'm like, I gotta get this post out. And she's she's very patient, but like it's like for me, like I like trying to get out something as quick as possible. Sometimes what slows me down is finding good footage and to know exactly what happened. So like someone like with Conor McGregor, a lot of times I'll talk on my post like this is my hypothesis, this is what I think is happening. Sometimes based on an injury, I'm like, well, I kind of want to wait to know exactly what happened. And some of that, like no matter what I do, I just got to wait for the news to come out because there have been times where I'm like, I think this is what happened, and then I was wrong, and then I feel foolish. So but a lot of times like I already have a lot of content. So all I have to do is take like an old post and then just kind of like rewrite it based on the actual event that happened. That one with Conor McGregor, I wasn't prepared for that one. I don't think anybody was. So yeah, that was an interesting one for sure.
You didn't see it coming, huh? So what have been your favorite injuries to write up? What are the most like high profile ones that you when you think back?
Um, I guess the Conor McGregor one I got a lot of attention for just because he's such a big athlete. Recently, and I don't know why, but there's been a few ACL injuries, these like non-contact dynamic valgus injuries. So they've been kind of interesting to write about just because for whatever reason this year I've seen like three or four, and like I haven't seen a ton recently. So that's been kind of interesting. Uh, I think liver shots are kind of an interesting one. So
Yeah.
I like writing about that one just because, most people don't really understand that it's like, again, when you hit the liver, it triggers the vagus nerve, which creates almost, it's like you're getting knocked out because you're stimulating the liver. So that's a kind of interesting one.
Is that what it is? It's attachment or it's proximity to the vagus nerve, and that's
Yeah.
what makes things shut off.
Yeah. It's called yeah, I'm blanking on it. Yeah, but that's the reason why it happens. Yeah.
Yeah, gotcha.
Yeah.
So what do you see in the future for you with what you're doing with Dr. Kickass and your clinical practice? Like, where do you want to be if everything goes well with your work as a jujitsu practitioner and as a PT? Do you have goals that you're got your sights set on?
Sure. So right now my business is doing good, but again, like even though um my business I get to work with combat athletes, I also like working with people like in person. So like right now, I don't know how long we're going to be staying in Washington. We're here for a few years. I don't know where we're going to end up long term. It would be nice if I could be in a place where I could see more combat athletes in person. Again, I don't know where we're going to end up. I don't know if I'm going to go back to Sacramento or somewhere else in California. Um, I do have a few interesting projects that I'm working on. So right now I'm working on like a continuing education. It's kind of like treating the combat athlete. And because I've had so many people reach out to me, they're like they're PTs and they want to work with combat athletes and they don't know where. And they're like, are there any good resources? And there aren't any resources. And like and I wasn't even planning on doing this when I created my Instagram, but I've just collected so much content and so much research because for me to have credibility, I like having some kind of evidence to say this is why I say this is what I think, right?
Right.
So I already have the research, so hopefully it's ready early 2023. It'll be a virtual con ed. how to treat a combat athlete. The first segment's going to be focused on grappling. I think the second one is going to be striking. But because it's virtual, it'll be like a, self-paced. With COVID, a lot of things are going that way anyway.
Right.
I don't know if there would ever be a real need to do it in person. I don't know if it would be like worth my time just from a like the amount of people who will fly in to see me, unless I ended up like doing it in a place like Los Angeles or San Diego where there's already a ton of people who like, but so that's kind of my first project that I'm working on. Then once that's out, I'm looking to do like kind of like a mentorship group on people who want direct feedback from me, because the Con Ed is going to be more research based, like everything that I can find research. But then the mentoring group would be more of, okay, well, what do I do in this situation? And it could be anywhere from like specific exercises, because in the Con Ed, I'm not going to say like, do this exercise. It's going to be more of, this is why neck strength is important. And then I'm going to let them figure out how to get the neck strong. The mentorship group would be like, all right, well, these are the methods that I use. People ask me all the time, they want to work with combat athletes. Do you have any recommendations? And I do. So I can go into that, but they can have direct feedback from me. So again, I would say hopefully be in a place where it's kind of like a hub for combat sports, so I can see more people in person, get that Con Ed going, and then, get that mentorship group. Those are kind of like the three professional goals that I look for in the future.
That's awesome. And then with the mentorship program, that would be for physical therapists, correct?
I'll probably do PTs and coaches, because some of the stuff I do is like sports performance. Obviously the coaches aren't going to get much of the PT aspect, but I know there's a lot of people that would want to pick my brain on things. The Con Ed course is strictly for healthcare professionals, but because it's going to be like they get to pick my brain. If a coach wanted to work with me, that's good. That's I'll work with them. So
right. They can pick your brain and you can answer it according to their background. That makes sense. So just a question, and you'd mentioned Joe Rogan. I feel like he's been a force. Jocko Willink, perhaps as well. Lex Friedman. There's a lot of high profile people out there that have great podcasts, and with the growth of the UFC as well. Do you feel like jiu-jitsu is on the rise, and where do you feel like it's headed at this point? Is it going to become a staple sport in the US?
So, that'll be interesting. Obviously, I think it's growing. I think a lot of martial arts, if you look at history, will like grow and then they'll kind of plateau. I am a little worried with jujitsu, because now I love jujitsu both from the self-defense aspect, from the mixed martial arts vale-tudo aspect, and then the sport aspect. I do worry at some point if jujitsu is going to go a path where it becomes too sport, and then its impact has less effect on mixed martial arts, because ultimately, like if you're an MMA fighter, like you need to do jujitsu. But a lot of the top fighters are going to be wrestlers, stand-up grapplers. I'm worried. And I think that there's like certain tournaments that might turn that around, like with ADCC, the Abu Dhabi Championships, because there's such a heavy takedown emphasis. I think that's going to be something that's going to preserve jiu-jitsu being like a useful for self-defense. Don't get me wrong, like I'll play on the bottom. I love guard and stuff, but when it comes to fighting, like you don't want to be on the bottom. It should be like the guard is supposed to be defensive. Like you're in a bad spot. Let's make this a less bad spot.
Right.
Sometimes in sport jiu-jitsu, it's like, well, no, this is a good position. But again, when you're getting punched in the face, it's not really a good position. So I guess it'll be interesting with how things are going. I mean, I do think that jiu-jitsu specifically has grown tremendously. It's also really fun. Like people who are like in their 20s and their 30s are going to do it when like you're not going to go wrestle, because wrestling in your 30s is just miserable. It's just not fun. Jiu-jitsu, a little bit safer. With a gi, you can slow it down. So, I mean, that's why I like jiu-jitsu, is like I'm not a particularly athletic person, so I can still be effective because I have pretty good jiu-jitsu, which is cool. Versus like if you want to wrestle, if you're not athletic, like it's hard, you know. So I hope it continues to grow for sure.
Yeah, I think it will. And the thing that I think jiu-jitsu has going for it is it's so fun to actually engage with and be there for it. The thing I worry about is I don't know if it has the same kind of watching appeal as other sports. but from the user perspective, the practitioner, it has, I don't think, any ceiling at all. I think it's just as fun as anything else out there, except for the fact that it's miserable when you start because you suck and you get sweated on, and you're on the bottom the whole time and tapping out.
Yeah, absolutely. I mean, I remember like my dad came to my first jiu-jitsu competition and like I won by triangle. And he's like, I have no idea what happened. But then they came to a fight and they're like, well, I get the fight. Like you punch the guy and don't get punched. Like it makes sense.
Yeah.
So yeah, I mean, what's interesting with like this most recent ADCC. So for people who don't know, ADCC is the Abu Dhabi Combat Club. It's kind of like the Olympics of nogi grappling. I think that nogi is a little bit more entertaining to watch from a spectator's standpoint. And the guy who's kind of managing that, this guy Mo Jessup, like I think he's got a real mind for growing it. So if there's anybody who can actually make it more of a spectator sport, I think it's him. I think they sold out the arena with like 12,000 seats but for grappling that's unheard of. So
Right.
like you said, I do think that the spectator aspect is going to be limited, but it will be interesting to see how it grows because the guy who managed ADCC in 2022 is going to do the next one in 2024. So we'll see if he can make it even bigger.
Yeah, and just looking at YouTube, it's getting a lot of eyeballs, right? Like how many views does the average Gordon Ryan fight have from ADCC recently? Like it's probably in the millions. So the jujitsu practitioner is also a fan of jujitsu, and so maybe that's where all the eyeballs come, and maybe it grows in that way because once you start doing jujitsu, then you want to watch it, and who knows? Just speculating there, but yeah, yeah.
You'll be
So
interesting. Well, one thing to add will be interesting. So Mark Zuckerberg, he starts doing jujitsu and mixed martial arts. So, I mean, hey, like he's like the guy of social media. So if anyone's going to grow, it's going to be Mark Zuckerberg.
that's right. That's right. Yeah. So what would I have two questions for you. Recommendations for someone who first starts jujitsu. Like, look, how do you recommend someone gets into it, and what kind of mentality is the best mentality to have as you first getting strangled every 4 seconds? How do you get good, and how do you maintain the right mentality? And then the other, I'll ask the second question after. So first
Sure.
on that one.
So there's plenty of gyms. It's growing. I would say there's some people that might have a gym that they think they like a little bit better than another gym. I would say just find any gym that you enjoy. Make sure it has a good environment, like one that's positive that you want to keep going to. As a new practitioner, I would say stay away from trying to win. So often people are just trying to like tap the other person out, which ultimately your job is to get better at things. So don't think you have to tap someone. Don't worry if you tap. I probably tapped like thousands and thousands of times. It is what it is. Like training isn't competition. It's okay to tap. So, what I would do is if you're brand new, go to class, try to practice what the instructor shows, or what you could do is like try to practice what he showed the week before, right? Because if let's say they're showing a certain sweep, everybody knows the sweep's coming.
Yeah.
Maybe last week they forget. So, it's good to go into training like with today, this is what I want to work. Like it could be very specific, like I'm going to work guard, or it could be like I want to work this specific De La Hiva sweep to back take setup. Obviously it depends on your skill level and who you're working with. But I think that's a good way to grow. This way you can kind of develop, like you could say, okay, do I have a game on bottom? Okay, I have a guard game. Now do I have a game on top? Do I have a takedown gamer? And then you can start to kind of like fill in the holes as you go.
Yeah, beautiful. I think that's great advice, and it's always good to hear. Don't worry about tapping because you will tap a lot, a lot, a lot, a lot. I think I'm probably already close to you in the thousands in just under a year, so fast approaching. Now the other question is if you're a young PT and you're paving your own way, and maybe you want to do something more entrepreneurial like you have done, maybe you have some kind of specialty like you have, which would be jujitsu or MMA. What would you say to the PT who wants to kind of branch out and do something more off on their own?
Well, I mean, I think for them, it would be like if let's say you want to work with a jiu-jitsu athlete, like join a gym and kind of like learn it, because while you're like until you like really do it, like you're not going to know. So this gives you a little bit more camaraderie with potential clients and patients, because, I've done this all the time. Someone gets hurt on the mat and I go check them out. And I don't even charge them. Like if someone gets hurt on the mat, like I'll check them for free, just because like I'm a good person. But, like you're there, you assess them. Oh, I think you have an MCL sprain. What do I do about it? Oh, come see me in the clinic. So it also makes it a little bit easier for you to kind of, like it's an organic way to kind of grow your practice of working with them. As you get better at jiu-jitsu, like you'll start to notice trends. Like I'm starting to notice a lot of knee injuries or neck injuries or whatever. And then if you want to be like a sports physical therapist, now you can again kind of blend the acute management, get them out of pain. Let's kind of like bulletproof their body parts so it doesn't happen again. And then how do we get them to work at the highest level? So like now I'm working with a competitor. Like how do I keep them competing at that highest level?
Sure. Beautiful. So for people who want to find you, it's Dr. Kickass on Instagram, right? Is there an underscore in between those?
Yeah. So it's the word Dr._Kickass.
Very good.
And that's the best way to reach out is on Instagram.
Okay. Very good. And that is, of course, how we connected. So I would encourage it. Mike, thanks for the time. This was great.
Thanks, man. Let's do it again.